Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. A new federal watchdog report says the flagship program meant to fix the nation's poorest performing nursing homes isn't working, and it may even be part of the problem. The OIG reviewed nearly a decade of data on the Special Focus Facility program, an initiative run by CMS and state agencies to help nursing homes with the lowest health inspection scores. The report found 64% of nursing homes graduated from the program had a serious violation within 3 years, and a third repeated violations year after year. The OIG says one major reason is an over-reliance on financial penalties. CMPs made up more than half of all enforcement actions. Critics argue fines don't change operations or improve resident care. They just punish facilities already struggling. Both the AHCA and LeadingAge agree with the OIG's findings, saying nursing homes need more non-financial remedies, things like hands-on quality improvement, mentoring, and operational support, instead of just fines. As nursing homes maintaining higher staffing levels after graduation had fewer violations and better sustained improvements, reinforcing what many in the industry already know: staffing stability drives quality. The OIG's urging CMS to rethink how it enforces improvement in these facilities, using more collaborative approaches and better data on ownership and staffing. CMS partially agreed, saying updates made in 2022 may already address some of these issues, but advocates say more accountability and transparency are still needed. Amid the ongoing federal communications freeze and government shutdown, skilled nursing providers are being forced to operate in the dark, waiting on critical policy updates affecting infection control, staffing, and reporting. The Senior Director of Nursing Home Quality and Regulations stated outdated guidances created major confusion, especially around COVID and respiratory illness protocols. Nursing homes are still being told to follow isolation rules, keeping residents separated for up to 20 days, even if they have no symptoms and are fever-free. Updated recommendations were drafted by the CDC's advisory committee, but never approved before the group was disbanded earlier this year. Providers are also stuck using old rules, forcing asymptomatic staff to stay home for up to 10 days, despite new evidence showing shorter isolation is safe. An approved 5-day standard's ready, but frozen in bureaucratic limbo. Other missing pieces include an updated definition of up-to-date COVID vaccination status for required CMS reporting, guidance that expired in September. Without it, providers can't be sure how to accurately report compliance, leaving nursing homes guessing about enforcement expectations. And without direction from CMS, many are turning to state or professional standards just to keep moving forward. Following the best evidence available, documenting every decision to be ready to show surveyors rationale until the freeze lifts, nursing homes are doing what they do best: caring for residents while waiting for Washington to catch up. Home health agencies could soon see major changes to how their quality and even reimbursements measured. According to an industry expert, the Home Health Consumer Assessment of Healthcare Providers Survey, or AHCA is getting an overhaul under the 2026 proposed home health rule from CMS. Right now, these surveys, which measure patient satisfaction and care quality, make up 30% of an agency's total performance score under home health value-based purchasing model. But CMS wants to shake that up. The proposed rule would remove 3 of the current 5 measures, leaving just 2: rating of patient care and willingness to recommend the agency. Each would count for 10%, reducing the overall weight to 20%, the hardest for providers to influence since agencies can't ask clients for certain scores. Nursing facilities should focus on education and culture. Every staff member, from nurses to home health aides, should understand what the survey asks, how daily actions affect patient perceptions, and why consistent courtesy and communication matter. If finalized, the new structure is expected to take effect in April 2026, and agencies that don't prepare now risk losing ground in both ratings and reimbursement. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.